With all this social distancing, you might feel a little bit isolated. We've been covering so many topics around the coronavirus, and one important one is mental health. And you've been talking to experts really all day long. What have they told you?
Yes, we wanted to learn about how people should be managing or are managing the stress and anxiety with coronavirus. There's just so much bad stuff in the news. I got calls from several mental health experts. They say their phones have been ringing off the hook today. Honestly, they've just been really busy. And the bottom line is everybody is going to handle this differently. They're going to perceive the stressors differently. Some people might feel withdrawn and isolated. Others might feel helpless. Some are annoyed that people are stressing out about all this. So the reactions are all over the board.
Okay, and what about tips? Do the experts have any tips for all of us average people?
They do. And so don't roll your eyes at these, because I think people sometimes say we hear this all the time, we get it, but it is really important to pay attention to these. And if we help one or two people with these tips, that's good enough for me. So we're going to put these up on the screen here. A really important one is to maintain your routine. So stay connected with your family and friends. If you are limiting your trips out of the house, at least try to keep some semblance of your normalcy. Also keep things in perspective. Stay informed. You want to get news from reliable sources and vet your information, but don't get sucked into the 24-hour news cycle. Another one, avoid crowds. Don't isolate yourself though, and then that kind of makes you feel closed in. A few more, get sleep and exercise, limit caffeine and alcohol. They mentioned caffeine can send you into overdrive. So avoid those, and then also take breaks, maybe play a game, do yoga, meditate, find something to find some joy in your life. Yeah,
kind of de-stress, bring your stress levels a little lower. So what about ways we can protect those who are elderly in our community, because they're at high risk?
Yeah, and that's kind of the thing. You don't want to minimize what people are experiencing or feeling, especially the vulnerable, like the elderly, those who are have compromised immune systems. And so we did talk with a doctor today who said, look, validate their concerns, maybe offer to bring something by their house. You can drop it off out front, but don't just dismiss it and tell them not to be concerned, because that doesn't help the situation either. And then, as always, if you're feeling anxious or you need help, don't hesitate to reach out to a family member or a doctor for help.